Namaskar. Welcome viewers to my YouTube channel Wellness with Dr. Deeptimala Agrawal. This is in continuation of the series with the specialist doctors in which I ask them simple questions and which they answer. Most of the questions which are asked to them by the patients in their OPDs and in their outpatient departments, and they answer it in a very simple way for all of you to understand. So today we have with us Dr. Anupama R. She is an ophthalmologist practicing in Bangalore. She works at Dr. SPK Eye Clinic, which was started by her mother, a renowned ophthalmologist from Bangalore, ex-director of Minto Hospital, Bangalore. Welcome, Dr. Anupama, to our show.
Hello.
She has an extensive experience of more than 2 decades of dealing with the eye problems. So I begin with these simple questions. As we have seen in the past 2 years, especially with the COVID around, and schooling has been from home, online, on the so the screen time of the children has increased. Not only children, even for the adults, for all those who have been working from home, the screen time has increased. So there are many frequently asked questions by the parents out of concern for their kids. So a few questions are like, there is too much watering of eyes for my child. Second is they are concerned about the redness in eyes. And another thing is my child rubs my eyes continuously. So what are your, based on your experience, what are your answers to this, Dr. Anupama? Your advice?
Yes, perfectly. Actually, all of us know that this online thing is going on in every person, irrespective of their age. So now children have become like, mini IT professionals. Uh, from morning till evening, continuously without breaks. Me as an ophthalmologist, I request the school authorities to at least give them breaks in between every period, but they don't. So it has become inevitable for the children to have some symptoms like redness. Redness is basically if the child already has some power and they are not using the glasses, then redness occurs. That is, infection is different, this is different. And watering can happen when they just forget to blink and keep on, looking at the screen. And a decreased blinking rate can evaporate the corneal tears, so leading to dryness and eventually blurring of vision. So we have to follow something called as 20-20-20 rule. This rule is that, like, for every 20 minutes, we are supposed to look far, about 20 feet far away, for about 20 seconds, and then again concentrate on whatever work we are doing. So whoever, it may be it children or IT professionals or anybody for that matter, every 20 minutes we need to give a break for the eyes in order to restore our capacity to visualize, for the muscles to act properly, and eventually the power should not happen to the children or whoever. Even elderly people also nowadays, they concentrate more on mobile and all these things, and they have more amount of dryness than children or adults, young adults. So instead of applying the lubricants always, it is always better to blink, be conscious to blink every time, and then follow the 20-20-20 rule.
Thanks, Dr. Anupama, for this very nice advice on 20-20-20 rule. So I hope people get the message and they listen to it and they try to follow. Another query from a parent is, once there's a child gets a power in the eye, their usual question is, will my child wear the glasses lifelong? One. Second, glasses have to be worn only, is it only while being on the screen? So they have these some queries. So how do you address that?
Yes, this is the uh, most commonest question asked by the parents when they visit me and when they come to know their child is having power. So they just want to get rid of the glasses. So they want to minimize, as much as possible their children wearing spectacles, be it lady, be it a girl who is going to get married later on, or a child. And if the child doesn't like to wear, they just tend to just ignore. And they basically we have to educate them that the glasses, that is myopia or minus power, is for distance. They are supposed to wear it always, because a child will always look at the distance too, rather than just sitting in front of the screen. Even elderly people, educated IT professionals also, they also don't understand what problem they are having, that they are myopic, that is, they have got short sight. That means they are able to see for near but not for far. So what they do is, as soon as we prescribe the glasses, they tend to wear only when they are doing their job or when they are studying, that is in front of the screen online. This is exactly, it's the opposite. We are supposed to wear it constantly, including when they are doing their near job. This is very important. And apart from that, we have to educate the parents. And nowadays, because the technology has advanced so much, we have got lasers, LASIK, and other. If we just apply laser to the cornea surface, then a person can get rid of their glasses at around the age of 23, provided the glasses prescription remains stable for 3 years. So they can undergo around 23 years of age. Once they have finished their studies, and when they have started their jobs, and the eye is stable, it's not growing any longer. So that is when they're supposed to undergo LASIK. And contact lens can be worn when they're around first PUC, like that, not during 10th or during second PUC, when they have got excessive studying to do. And they tend to forget taking out their contact lens while they're going to sleep, and very bad conditions of the eye ensue after that. So this is what we tell the parents. And one more question you asked, Deepti.
Yeah.
You asked me one more.
Mm, um, I think you've answered that. Uh, 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 Parents' queries to this only. You have addressed this. Now, at this
Okay.
point of time, what comes to my mind is a simple disease like diabetes. So, me being an intensivist, we deal with patients who have very high HbA1c above 10, and usually they have all the complications associated with diabetes. So, this is another way to educate people that well controlled diabetes, blood sugar levels, and HbA1c below 7 will delay their chances of affecting other organs of their body, say eye, kidney, and peripheral nerves. So, in this, there's a very important entity of diabetic retinopathy, right? Effect on eyes. So,
Yes,
many of the
actually,
what is the right time once a patient is diagnosed a diabetic? How often should they go for a eye consult, and how regular? Because this is missing. This is outrightly missing.
absolutely.
Yeah.
Mm.
So what?
See, actually, see, other organs of the body, they tend to get affected around 10 years of duration of diabetes. But the eye is not like that. Irrespective of the duration, I mean, irrespective of the control, whether diabetes is under control or not,
Yeah.
this diabetic retinopathy changes can happen anytime. So the duration usually, yes, it is around 10 years, but still we have to do early screening every 6 months once diabetes is detected. And then irrespective of whether it is under control or not, this can happen, and small diabetic changes can be stopped by applying laser to the particular areas where there are fragile blood vessels which cause my small bleedings inside the eye in the retina. So this is highly essential. Otherwise, once if it is full-fledged diabetic retinopathy, then the person gets a lot amount of bleeding inside the eye, and that eventually when the blood clots inside the eye, it pulls the retina also, and it leads to retinal detachment, which most of the times it is irreversible, and the patient will end up having only 1 meter vision, or even macular complications, which are the early complications in diabetic retinopathy. So one has to do screening on the onset of diabetes every 6 months. This is very important.
So this is a great message to the public. Once you're diagnosed with diabetes, go for a regular eye consult to an ophthalmologist every 6 months for screening, so that if there is any issue comes up, it can be addressed timely. Now,
Yes.
another very simple thing, once an ophthalmologist prescribes any eye drops to any patients, so it is used for a few days, then that eye drops keeps lying in the house. Then the need arises after, say, many months, after a long time. Now the family does not know whether to use it or not. Now, what is the criteria? Any number of days after opening of the eye drops, or the expiry date which is mentioned?
Yes, this is very important actually, because even educated people, especially educated people who are able to read, they tend to see the expiry date, and if it is in 1 year, they tend to keep the same one and keep on applying. And this is dangerous in case of any infection like conjunctivitis or redness of the eyes. So they tend to get infected again and again and again, and this is very dangerous, as you all know. So what we all suggest is that once you open the bottle, it it is not sterile anymore, it gets infected. So the duration of installation of eye drops recommended by the ophthalmologist should be the one that they are supposed to use the same bottle. After that, they're supposed to throw the bottle, dispose it off. They have their prescriptions with them, so there is no need for them to have the same thing, but come and consult the ophthalmologist again and ask whether the same has to be applied or a different one. Depending upon the situation severity, we are going to advise the eye drops, not what the person is already applying. That is very important. Please throw off the eye drops.
Okay. Yeah, that's a nice message, and rightly said. It's not the uneducated. Educated people, they have all the more queries. Yeah. So important is the time of the opening. These questions,
Yes,
they
yes,
sound very, very simple and very naive, but I know they are important because majority of the people, they really do not know the answers. Yeah.
true, true.
Yeah. Another thing is cataract is so prevalent in our society, right? So many of the elderly people have it. And many times they delay it, or I don't know out of what reasons they will not tell it to their uh, people in their family. So, what is the any advice on right age for the screening of such people for cataract, and right time for cataract surgery?
Nowadays, cataract is not senile cataract anymore. As more and more people are getting diabetic, thanks to COVID situation, or due to excessive intake of high calorie food. So people are developing diabetes, and we are getting diabetic cataracts called as complicated cataracts at very early age, like around, the duration of diabetes, if it is just at the beginning also, one detects, we ophthalmologists tend to detect diabetes through the cataract that a person around the age of 40 or 50 comes up with defective vision. So this is one part. Another part is now senile cataract, parents they're reluctant. They hear to somebody else telling that the outcome of their cataract surgery was not good, either relatives or friends, and so they are afraid. So nowadays, the technology is so advanced that a person gets their cataract surgery done within 10 minutes, and the person can go home immediately. So they need not tend to get admitted, stay for 7 days as they used to before. And there is no such thing as a big, thick lens. The lens is implanted inside the eye called as intraocular lens, as everyone knows. And so they have to wear glasses for only near vision. So they're supposed to view the TV, watch mobile. There's so much to do after 70 years of age. So no such thing as screening, but if the person is having diabetes, better to get, as usual, 6 monthly checkup. Then we detect cataract in them. If it is complicated cataract, get it operated as soon as possible when the diabetes is under control. And it is up to the children to educate their parents too, who don't know that the technology is advanced now, and very small incisions are made. Within 15 days, a person recovers completely. They are able to go for their regular walks after 15 days. So you will have to counsel, children have to counsel their parents now.
Okay. Now, another question which comes to my mind, there are many people who complain of regular headaches. And for the headaches, they they have consulted a physician, they have consulted a neurologist, they have got their CT scan done, they have their MRI brains. And it's a casual mention if somebody discusses with me this, and I just ask them, did you show the eye specialist? The answer is no. So how's your experience on that? Because with headache, the first thing which should come in mind is vision and an eye expert. So yeah.
True. Actually, the vision part of it, people are unaware of when they tend to get headache, because headache happens only, or it can happen once the power sets in. Like if it is only 0.25 or 0.5, which is the least power, they don't know that they have got vision problem and they tend to get headache. So they don't come to the ophthalmologist immediately. Some people will, even though they know that they are not able to see, they tend to prolong it because they don't want to wear spectacles. So such things happen. And nowadays it is on the rise, because the IT professionals are into their so much of near work, that they are starting developing headaches with very low power that has to be dealt with by the ophthalmologist. But these uneducated, lower economic strata people, they don't know that the vision is the cause for their headache. They tend to go to hospitals, and there, I feel even the doctors have to counsel them, tell them first get an eye examination done, but they tend to, agree to whatever anybody else says and go randomly and get all the investigations done. So what my advice is to the common people, first and foremost, before going to, like if you have fever with headache, then absolutely you're supposed to go to the physician and get the infection treated. But if you just keep on getting headaches, with you being normal always, then please consult your ophthalmologist as soon as possible. Don't keep on taking tablets, or don't get yourself exposed to radiation and other harmful elements. Just come to the ophthalmologist, just get a checkup done whether you have got power. And if you wear that particular glass, be it just a plain glass, it looks like plain glass, 0.25. And if you wear that, you will get rid of your glasses get you rid of your problem, and then you need not take your tablets lifelong. People also, think they have migraine. They know what is migraine, so they keep on taking, anti-migraine tablets from the medical shop. They don't come over to the ophthalmologist at all. They come to us, and even after prescribing, they say, "No, I have got migraine. It is not my vision problem." So they don't want to wear spectacles. So it is up to us. We have to counsel them, tell them these are all dangerous tablets to be taken lifelong. And one fine day, this will not work also. Please take your tablets. Please do your, you'll have to wear your glasses and then continue with your jobs. The efficacy of the job will be better.
So still the stigma of wearing spectacles,
Yes.
it still continues in our so-called modern society also. With the advent of so many newer brands and beautiful, I'm not here to recommend any or
Yes.
advertise any, but still you have that lens card, so beautiful
Good lenses have come. Good
lens
lenses have come.
they have come. So
Frames.
yeah, frames, yeah. So with this, you have answered so beautifully such simple and but perpetual questions and problems of the people. I would like to ask you, with your medical career of practice of more than 2 decades now, it's above 20 years you have been practicing, and of late you have been following your passion of music. So, is it a coping mechanism for to for the stress? And
Yeah,
how do you find time for it, or whatever?
yeah, it's a stress buster. Just like how IT professionals have 2 days holidays, even I have made myself having 2 days holidays. And I go for stage events, and I tend to practice music. In fact, I'm going for Hindustani classical vocals now. I'm taking my third exam. Initially during childhood, I had done my Carnatic classical. So it's a real stress buster. You hear to music, you sing. If you have got a good voice, then nothing else, no doctor is necessary, I feel.
Yeah. That's there. So that's a great message to our doctor community also, that along with profession, we need to follow our passion also, because
Yes.
that is must for our health. We need to take care of our health. So
So
yeah,
then you'll be able to serve the nation.
yes. So
Mm.
with this, I would like to thank Dr. Anupama for taking time out from your such a busy schedule. And thanks a lot. Thanks, viewers. If you, after listening to this question answer session, if you have any queries, you can put it in the comment box. If I'll be happy to answer. And if there is anything, I will ask Dr. Anupama and we will answer that. Okay. Thank you.
Thank you, Deepthi. Thanks, Deepthi, for giving me an opportunity to just tell about our Aftal part of the journey, because this is highly essential now. All of you, please do follow whatever advice has been given now. Um, Good night.
Thank you. Thank you, Dr. Anupama.
Thank you.